Diseases of the respiratory tract in swine. The causes can be viral, bacterial, or parasitic. The viral diseases include swine influenza, porcine circovirus 2, PRRS, cytomegalovirus, and classical swine fever and African swine fever, and Ojeski disease, as well as swine respiratory coronavirus. The bacterial causes include Mycoplasma hypopneumoniae, Actinobacillus pleuropneumoniae, Actinobacillus suis, Bordetella bronchoseptica and Pasteurella multicida, as well as Glasarella parasuis, Pasteurella multicida, and Streptococcus suis, as well as Salmonella. And the parasitic diseases are Ascaris suis, due to the migrating larvae, and the Metastrongylus. Respiratory diseases are the most important cause of economic loss in pig farming. They are ahead of digestive and reproduction problems. For every 100 gram of lung or pleura, we have a plus 10% feed consumption, and for every 1% pulmonary lesions, we have a plus 1.2 days fattening time. In adults, around 50% of heat loss is through the respiratory tract. Environmental factors contribute to these conditions. This includes temperature, dust, gases, and humidity and airflow. If the temperature is too warm, it leads to hyperventilation, and if it's too cold, in order to increase heat production, the animal's cellular activity will decrease and cortisol will decrease, and this can lead to pneumonia and pleuritis. The dust comes from dry concentrate feeding, and gases include pneumonia, which can cause edema, and H2S, which can cause pneumonia. The optimal humidity is around 70 to 80%. If it's too dry, it causes vulnerable mucous membranes, and if it's too humid, it causes a damaging effect of ammonia. And the optimal airflow is around 0.1 to 0.3 meters per second. Atropic rhinitis is caused by Bordetella bronchoseptica and Pasteurella multicida. It occurs in piglets and growers, and you can see sneezing and seromucus, which leads to bloody discharge. You can see a face and nose deformation. In the case of Glasser disease, it's caused by Glasarella parasuis, and it causes fever, laboured breathing, and painful tiptoeing. Swine influenza is caused by the influenza virus. It affects all ages, and it causes high fever, dry cough, and painful breathing, and it can cause an explosive epidemic. Ascaris is caused by Ascaris suis, and it causes cough and acute pneumonia, and worm eggs can be found in the feces. Ojeski's disease is an alpha herpes virus. It affects all ages. In piglets, it causes neurological signs, and in adults, it causes non-specific respiratory signs. These include fever, nasal discharge, and laboured breathing. It also causes abortion. Pig typhus is caused by Salmonella typhimurium. It occurs in growers mainly, and it causes non-specific respiratory signs, and it leads to weight loss and intermittent diarrhea. Classical swine fever and African swine fever affect all ages. They cause anorexia, high fever, and non-specific respiratory signs. They also cause skin hemorrhages, obstipation, and diarrhea. In unweaned piglets, sneezing is caused by cytomegalovirus, PRRS, and Ojeski's. In weaned adults, it causes coughing, such as swine influenza, classical and African swine fever, Ojeski's, and PRRS.